Hi, September is Blood Cancer Awareness Month, and today my colleagues and I wanted to talk to you about some of the signs and symptoms of the three common blood disorders, which are leukemia, lymphoma and myeloma. I'm Angela Gascoigne, the lead Haematology Clinical Nurse Specialist here at Chesterfield Royal Hospital, and with the help of my colleagues we want to give you a brief overview of each blood disorder and what the possible signs and symptoms are. If at the end of this video you would like to learn more about these blood disorders, there will be some links which you can follow. So, without further ado, I will hand over to my colleague Gemma, who will talk about leukemia.
Leukemia is a type of blood cancer that affects the white blood cells. White blood cells, as we know, play a big part in fighting infection, but in leukemia, these cells are abnormal and they don't work properly. This can lead to a person getting repeated infections and is often why they go to see their GP. Also, if you have leukemia, the production of normal cells such as red cells and platelets can be affected, and people can experience shortness of breath and notice that they bruise or bleed more easily. There are different types of leukemia depending on the precise type of blood cells affected and how the condition develops. Some types are slow growing and are called chronic leukemia, whereas some are fast growing and are called acute leukemia. Both types of leukemia will require treatment, and therefore it's important to recognise and seek further advice if you have any of the following symptoms: repeated infections, bruising or bleeding more easily, fatigue, which is a tiredness that lasts a long time and doesn't improve with rest, fevers or sweats, bone or joint pain, and unexplained weight loss. I'm now going to hand you over to my colleague Rebecca to talk about lymphoma.
Lymphoma is a type of blood cancer that affects the white blood cells called lymphocytes, which are part of our body's immune system. In lymphoma, something goes wrong with the development of lymphocytes and they can multiply out of control. Most people with lymphoma usually notice they have developed painless swellings or lumps in the neck, armpit or groin. Depending on the type of lymphoma, these swollen lymph glands can develop quickly in weeks or over a longer period of time. As well as lumps and bumps, other common symptoms of lymphoma can include fevers or unexplained temperatures, drenching night sweats that soak your clothes and bedding, unexplained rapid weight loss or fatigue. If you have any of these symptoms, please seek further advice from your GP. I will now hand over to my colleague Tracy, who will talk to you about myeloma.
Hi, myeloma is a type of blood cancer that affects the plasma cells. These cells produce antibodies which help us to fight infection. If the plasma cells become abnormal, they produce abnormal antibodies which make it a lot harder for us to fight against infections. Plasma cells are produced in the bone marrow, and if they become abnormal, they can multiply and squeeze out the production of other normal cells such as the red cells and platelets, which are also made in the bone marrow. If there are a high number of plasma cells in the bone marrow, this can lead to anemia and bleeding problems. However, the most common symptom of myeloma is back pain. Fortunately, most people who present to their GP with back pain don't have myeloma, as it is quite rare. However, if you do have persistent back pain and are not getting any relief from painkillers, please let your GP know. There are some specific blood tests that can be taken to help your GP determine if you need referring to our haematology clinic. The GP may want to take a range of blood tests, as myeloma can also affect the kidneys and calcium levels in the blood. If you have high calcium levels, you may feel very unwell with nausea, drowsiness and confusion. We would strongly advise you to see your GP if you have any of the following, which is persistent back pain, breathlessness, which can be caused by the anemia, fatigue, nausea, drowsiness or confusion. I'm now going to hand back over to my colleague Angela.
So, if you are experiencing any of the symptoms described, please visit your GP so that they can find out what's causing them and make sure you get the right treatment if you need it. For more information about signs and symptoms, other types of blood cancers and the support available, please follow the links that accompany this video. And don't forget, we're always here to support you. If you are a current patient and have any questions, you know where we are and how to find us. You can also contact our fabulous Macmillan information and support staff for additional support and advice, and these can be reached on 01246 516406. Thank you for listening.